Hello all, this is Dr. Shilpi Reddy from Kim's Cuddles, Kondapur, Mother and Child Center. I wish all women out there a very happy Women's Day. It is very clear that a woman is not only the center of the family, she is also the center of any kind of health or any kind of activity that improves the health of the family, in turn health of the society and the nation. So it's the women's initiative that we are going to talk about today and how to improve women's health. So for this time, choose to challenge is the slogan for this Women's Day. Yes, you should always choose to challenge, and any challenge that women take up, definitely they see success in that. And in terms of health, it is more about awareness, it is more about taking care, and it is more about sustainability and doing the course on a regular thing. COVID has taught us many things, and in such situation when everybody is fighting COVID, women should take care of their health and in turn their family's health. Today, on behalf of Women's Day, I want to discuss about 7 topics that women should always discuss about their gynecologist without wasting time. It is very important that these topics are discussed timely for the best of treatment available and for your health purposes. The topics for today's Women's Day that I have chose are painful periods, very important in terms of managing your day-to-day activity, vaginal odor or any kind of vaginal problems, any swellings or any problems in the perineal area, any problems of your sexual problems like your dryness and all that. The most affected part is people don't discuss about sexual history at all. And that's really, really important that you are discussing about sexual history. And still today, people think about discussing about urinary problems and urinary incontinence is a taboo. It is not. You have to discuss anything related to urinary symptoms as early as possible to deal with the problems. And also, not the least, low libido. Yes, women need to change the attitude towards sexuality. So let's discuss one-on-one in detail. When it comes to painful periods, periods are definitely a part and parcel of life. As soon as they start, it is important that training is given to adolescent girls about period timing, the way they have to be maintained, about the menstrual hygiene and all that. Any amount of painful periods definitely impact quality of life. You have to take care that quality of life is not impacted. Minimum amount of medication to alleviate symptoms is definitely warranted, and it is not stopped for everybody. But painful periods need to be examined by the doctor, definitely, to look into reasons like endometriosis, fibroids, adenomyosis, any congestions, any overbleeding history, any increased size of the uterus, or any pressure symptoms, or anything related to painful periods need to be discussed with the gynecologist as soon as you have symptoms. It is not that you will look into 2-3 cycles and then you will go. It is not correct. Once you have an experience of painful periods, it can be as simple as anovulatory cycles, as simple as endometrial issues with thickened endometrium and clots and bleeding with pain. It can be adenomyosis, it can be fibroids, it can be infections, it can be pelvic inflammatory disease. It can be anything, but it needs evaluation and you have to reach out to a gynecologist as soon as possible. If an pathology is identified by ultrasound, which is definitely going to help you diagnose any issues, you can take remedial measures for the diagnosed problem. If there are no issues, definitely you will be elevated that you don't have an issue, and you can take minimum amount of painkillers after you have practiced some home remedies like hot fomentation, some relaxation techniques like meditation, yoga, some physical exercises, some back massages, and some pressure points that elevate the symptoms of pain. And diet also elevates lot of, decreases lot of pain symptoms if you take the proper diet during periods. So it is mandatory that you should go to the doctor and discuss about your period issues in detail. Never neglect, because anemia is something Indian women are still fighting for. Painful periods with increased amount of blood loss is one of the major factor that leads to anemia, other than the nutritional factors. So definitely look forward and vouch for help and go to the gynecologist as soon as possible. The second factor that we are looking forward for is any amount of vaginal odor, increased vaginal discharge, discoloration of discharge, any itching, any foul smell, or anything that is related to vaginal secretions that are suspicious. Reach out to the doctor so that they will do the required examination and figure out what kind of an infection it is. When you send the swabs for culture sensitivity and gram stain, you can identify the bacteria or fungus or what is causing this kind of infection. Whether it is normal discharge, whether it is abnormal discharge, you can easily figure out once you go for examination and take the required amount of medication. If you are sexually active and you have infections, vaginal infections, definitely you have to have your partner also managed well. Just check out for sugars, whether if you're having regular fungal infections or yeast infections, your sugars might be high. Just please check on that. Not only that, whenever you have history of infections and all that, you should mandatory go for vaginal examinations, for pap smear and swabs taken in particular, because random medication will not cure if it is not the identified organism and sensitivity of the drug does not work. This is one of the reasons why antibiotic resistant organisms are coming up. So it is mandatory that you go as soon as possible. Whenever you have identified symptoms, go to the doctor, figure out what it is. And people who are sexually active, make it a point that even if you don't have any problems, go for a pap smear on regular basis. Cancer screening is really, really important. Everybody and anybody who is sexually active, go for regular pap smear examinations. Do your self-breast examination every month once in front of the mirror, and with your palm, just examine your breast and look for any kind of lumps which you feel like this. So it is good for your health, and keep monitoring about preventable causes like cancers. And there is vaccine for cervical cancer which can be taken by everybody who's from 9 years to 42 years old, and even sexually active women can take the vaccine once, if you are sure that just make sure that you are not having HPV virus by HPV virus testing, and then you can go for vaccination. Vaccination is very effective in prevention of cervical cancer. It's really, really important. Pap smears, self-breast examination, regular checkups, at least ultrasound monitoring of your pelvic organs, your regular mammography once you're above 40 years is important in terms of looking out for any cancers. So any order, any problem, reach out to the doctor. Not only order, if you find any swellings in the perineal area, usually people have infections like Bartholin's glands. They have recurrent episodes of pubic area folliculitis, hair follicle infections. There are a lot of glands there which can be infected, like Bartholin's gland, and you have a lot of swellings that usually happen when you have fistulas and perineal fistulas and all that. Definitely you have to go to the gynecologist, figure out what it is. Make sure you take in medication for that, and vouch for preventive mechanisms to avoid a recurrence of such problems, because Bartholin's is very notorious to recur. If you have one side, the other side can also come in. And regular methods of cleanliness have to be maintained. Menstrual hygiene has to be maintained. This has to be explained to pubertal girls and young girls along with everybody, even up to menopause, that menstrual hygiene is one of the most important factor in preventing infections and problems like boils, furuncles, Bartholinsis, abscesses, and all these things. So definitely look out to the doctor, go to the doctor as soon as possible and figure out what it is and why you had a swelling. It's important and you cannot neglect that. And the early you diagnose, the better the treatment would be. And recurrence is one thing that you should, avoid, and complete treatment depends on how you approach the doctor. So early recognition is important and early treating is important. And the next point that we need to discuss is any discomfort during sexual activity. It can be dryness, it can be pain, it can be vaginismus, it can be fear, it can be anything. This needs to be discussed with the doctor in detail, because you can have yeast infection, you can have bacterial infection that can give you dryness, it can give you severe pain during intercourse. That has to be looked forward for. And if you have pain during intercourse, it can be endometriosis, it can be pelvic inflammatory disease. Please go to the doctor as soon as possible. The more the delay is, the more severity of the infection, and there is progress of vaginal infections into the pelvis, leading to a pelvic inflammatory disease. Pelvic inflammatory disease does not seem to be very low, because once there is an attack of pelvic inflammatory disease, it takes its own time to decrease, and there are at times the lasting impact and effect on the tubes of the uterus, blocking them if you have severe grade of pelvic inflammatory disease. So vaginal infections, dryness, pain during intercourse, and all these symptoms definitely have to be taken care by the doctor. The sooner you go, there is a lot of scope for preventing serious problems. When it comes to sexual history, there is a lot of taboo in the current scenario. Female sexual dysfunction is on the rise, and because of multitude of roles that women play. They have to do their house chores, they have to do work in the office, they have to commute, they have to deal with a lot of stress, and they have to deal with a lot of physical exertion. All these things on daily basis, on the physical health of the woman, they always feel tired by the end of the day because of the activities around them. There is a there are difficulties in accepting the point of sexual dysfunction. They feel that they do not have time for such thing, or they're feeling tired. But the aspect of sexual dysfunction is more intricate and more deeper. Women are losing the interest in having, eliciting the sexual history to the doctor. It is an important part of life that you should have a healthy sexual history, and if there is any deviation from normal, or it is anything that is deviating from the normalcy, or you are recurrently having less libido and less interest in sexual problems, so definitely you have to approach for help. It can be a localized problem, it can be tiredness, it can be your anemia, it can be because of your exhaustion, because of stress. There are multitude of things impacting women's life. It is important that these things go to the doctor and give your history, so that help is given as soon as possible, because quality of life is definitely important. It is not the number of days that you live, it is the number of days that you live to the optimum point that you really want to live with happiness. So quality of life is really important, and the day you are satisfied in your life, that is the day that needs to be repeated. So it is not about quantity of life, it is about quality of life and day-to-day health that women should look in for. Simple reasons for tiredness can be lack of hemoglobin, that is anemia. It can be vitamin D deficiency, it can be calcium deficiency, it can be multi-nutritional, multivitamin and micronutrient deficiencies, which give lethargies and which give tiredness very early. Please look into these aspects, get yourself evaluated. You can have even thyroid issues, which give rise to a lot of lethargies and a lot of weight gain also. So you have to go to the gynecologist as soon as possible and get yourself checked if you face such problems. There is another aspect of health problems that women usually neglect, that is urinary incontinence. The scope of urinary incontinence is increasing because there is so much of obesity that is coming up. There is so much of extended labors and labor analgesia given, and inability to push, and a lot of trauma to the perineum. At times there is almost 1 to 2 hours of full dilatation. People are not able to push the baby. There is so much of pelvic floor damage, and definitely lack of physical exercise before going into labor, that is antenatal exercises. They do not do the pelvic strengthening exercises, and even after having a normal vaginal birth, they are not interested in taking care of their pelvic floor. Kegels exercises and pelvic floor exercises are mandatory after childbirth, and it is important that you practice these exercises with the help of a qualified antenatal and postnatal physiotherapist, so that your pelvic floor anatomy and structure is maintained. The tensile strength of pelvic floor muscles is maintained. If you show negligence at that point of time, you always have at the later date problems of urinary incontinence, be it stress urinary incontinence, urge incontinence, or some type of fecal incontinence, or any of these pelvic floor dysfunction problems. It can be the laxity of pelvic floor, decreased libido. All these things definitely have the role during your pregnancy. So if the peripartum period, that is immediately before your delivery and after your delivery, those are the days that you need to be extra cautious of. Look at your health. Anemias can precipitate a lot of pelvic floor dysfunctions. They can give rise to lax perineums and all that. So you have to take care about your health and discuss with the gynecologist, especially the urogynecologist, when you have issues with urological issues and incontinence issues, because the earlier that they are addressed to, the easier way that you can deal with correction. Because if you have symptoms, the treatment aspect of exercises play the pivotal role and the first come first role for treatment of pelvic floor dysfunction. If you have prolapse completely and you delay small symptoms and incontinence and all these things, you will eventually have larger cystoceles, larger problems like complete prostatentia, pelvic floor problems and all that. So it is important that you deal with problems when they are the earliest, and at the earliest you will have smaller things to deal with and easier things to deal with. And it is important to go to the doctor and seek help when you have these problems. It is not only about pelvic floor problems, urinary incontinence issues, laxity of the pelvic floor muscles. There is loss of libido that we are seeing in. So female sexual dysfunction needs to be addressed to. There should be a listening ear on the other side. You just can't go and talk to talk about female sexual dysfunction to people randomly. There should be a listening ear and an understanding ear on the other side, who will listen to your problems and give you your kind of solutions which your body needs and your lifestyle needs. And you just can't have 1 or 2 tablets here and there and say you will be all right. It is tailor making the decisions, and there should be very peculiarly problematic areas that you need to identify, give solutions to those areas. Only then you will have solution for smaller issues or bigger issues. So you should consult to the gynecologist as soon as possible. Whatever the symptoms may be, it can be small tiredness, or it can be increased bleeding, or it can be pain during bleeding, or it can be decreased libido, or it can be white discharge, or it can be anything for that matter. You have to seek help. The day you prioritize your health, you are definitely healthier, and a healthier mother definitely promotes a healthy family and a healthy nation in turn. Thank you and happy Women's Day.